As all of you have heard so far, the cases of the coronavirus that we've had in Singapore have been mostly imported cases as well as a few locally transmitted ones. And we have been able to ring fence and isolate each time something happens. The new development now is that we have a case without any links to the previous cases or any recent travel history to China. And in fact, we have been preparing for such an eventuality, and that's why we've already strengthened our measures over the last few days. But today, given the latest developments, and with the step up to DORSCON Orange, we will now step up further precautionary measures. First, we will advise all event organizers to cancel or defer non-essential large-scale events. And for those who wish to proceed, we would want them to take all necessary precautions, and that would include carrying out of temperature screening, turning away of unwell individuals, and making sure that the event venues are adequately ventilated and equipped with facilities for hand washing. We have a series of precautions that we would want all event organizers to take should they wish to continue with their events. Second, all employers and individuals should implement regular temperature taking. This should be done at least twice daily, and organizations can decide on different ways of doing it. It doesn't have to be done at the individual level, and at office you can do it at the entrance to the office, so that whenever the employees come in, they take a temperature, and when they depart from the office, they take the temperature again. And then anyone with a fever or anyone who is unwell should see a doctor as soon as possible and avoid crowded places as they approach or as they make their way to see the doctor. Third, all workplaces should step up their business continuity plans. Right. Many have already done so. Many already have put in place these plans. We would like all workplaces to ensure that their plans are in place and step them up. And that would include taking measures like telecommuting or having split teams organized and operating separately. Right. These are important measures to also help to reduce the risk of transmission, of widespread community transmission. So these are 3 additional precautionary measures that we are taking today. In addition, for the vulnerable groups, we have another 3 more measures. At the hospital level, MOH will be implementing temperature screening and closer controls of entry points to hospitals. And our hospitals will also introduce measures to care for patients with pneumonia separately from other patients to reduce the risk of transmission. For schools, we have heard from the director of schools just now how they will be suspending all inter-school activities and external activities. And finally, for preschools and social elder care services, we will impose tighter controls on visitors to these premises. Overall, we are still working hard and doing our very best to prevent broader community spread of the virus in Singapore. So that remains our strategy today, but we have to be prepared for the situation to evolve in different ways. One scenario could well be that despite our very best efforts to contain, ring fence and isolate each case that comes up, despite our best efforts at doing so, there is wider community spread. And if so, as we have done already, we will have to reassess the situation if the situation worsens, and we may well have to take more stringent measures beyond what we are announcing today. There is another scenario which, in a way, the Director of Medical Services alluded to, because if you look at the situation now, the mortality rate in China is 2%, but outside of Hubei province, the mortality rate for this virus is 0.2%. It is much lower than SARS. And if the mortality rate remains low or even continues to fall further, depending on the evidence and depending on how it evolves, then I think we are dealing with something quite different, and we may well have to consider a different approach. So these are two scenarios of how the situation may unfold. It's too early to tell right now what the strategy will be, but I'm just sharing possibilities of how things may unfold in the future. Meanwhile, for now, I think all of us will have to do our part to stay vigilant, to keep our guards up and carry on with our lives. And Minister Gan earlier already shared some practical things that all of us, every Singaporean, can do to protect ourselves and our families. And I would summarize it in 3 simple steps. First, wash our hands with soap regularly. We can't say this enough, right? We keep emphasizing this. Wash our hands with soap regularly, every day, more than once, many times as you can. Number 2, avoid shaking hands. So we are, advocating everyone, just do a different form of greeting, whatever suits you, but avoid shaking hands. And don't use your hands to touch your face, because all the medical evidence shows that the transmission happens a lot through hands. Right, so that's the second thing we can all do. And thirdly, all of us can take our temperatures daily, twice a day, in fact, as we have suggested just now as an advisory to all employers and individuals. And then if any symptoms show up, if there is any sign of a fever, immediately go and see a doctor. So these are 3 practical, but we believe, based on the medical evidence, effective ways that all of us, all Singaporeans, can take to protect ourselves and our families. Now, we know that these are challenging times. Singaporeans are anxious and worried. We understand these concerns, and we are doing our very best to put in place effective measures to protect ourselves, to protect every Singaporean. And I am confident that if we continue to stand together, if we continue to look out for one another, we can overcome this challenging situation together.